Hey everyone, it's Dr. Russell. So it's been a little bit since my last video, so I wanted to touch base and just kind of update you on some changes that are happening personally, professionally, and just kind of give you the behind the scenes on what's going on. So we made an announcement yesterday. We are moving with the pandemic that we are currently in. Obviously, no business has gone unaffected, no household has gone unaffected, and we are also not immune. We started and moved to the beautiful space on Court Street to create a more integrative clinic, and I still feel like that could possibly be the goal of Frederick Natural Health Center in the future. And we could have stayed and made it work, and I was really torn 50-50 on whether or not that made sense at this time. But I've recently had some health issues that have kind of popped up, which I'll get to in a second. And that made my decision really clear on what needs to be done. And I know I've heard from several patients over the last few weeks, as well as friends and colleagues, that, you know, as hard as this time is right now, it is, some people are seeing it, and I'm choosing to see it as a gift as we kind of reflect on what's really important in our lives. You know, our health is really important, our families, our friends are really important, our community health is really important. You know, all this other busyness and achievements and all this other stuff is not really important in the long term. So because of everything, we are going to be downsizing and going back to just me on my own. There's just so much involved in, you know, running a clinic, having multiple providers, and it's just made me realize that been getting away from the stuff that I love of working with patients, and you know, it's hard for me to be there and be undistracted with so many other things to manage for the business. So we have a great space on Ridgefield Road with some therapists that were, you know, in the same office together. You know, there is parking, which, you know, whenever we get back to normal where you can come in and park, obviously that'll be great to have. So I'm really looking forward to this new chapter, you know, to see what that kind of brings. And I'm honestly really excited about it. So speaking of the health reasons that got me to this, you know, I just wanted to share a little bit more personally about that, because for me it's really reinvigorated why I got into this and why I do what I do. So was having some issues. We, you know, moved and had to go to urgent care at one point, was misdiagnosed at that time and questioned the diagnosis, then talked to my primary care, who unfortunately, as soon as I mentioned just a brief mention of stress, immediately, well, that probably explains what's going on. You know, that's probably likely, you know, that can do a lot of stuff, which I know a lot of you have heard as well from your doctors. Went to a specialist finally after multiple tests and things. Have gotten the correct diagnosis that I kind of thought it was from the beginning. But even in that process, knowing that I am in the best position as an educated doctor on things, feeling like I wasn't even heard or had a real say in the decision when it came to what choices were being made. You know, I was told that this medication is what you need to start, and you know, when questioned that and stood firm to it's not the route I want to go to start, was told, oh, this medication is really benign, so you know, if anything, let's just try this. So I get, and again, and I don't think I ever forgot, but it was a big, again, wake-up call of like, oh yeah, this still sucks, and this is still the state of healthcare, where even someone who is educated in healthcare is not given the ultimate decision for their own health. So all that is to say is that I hear you, I feel you, I have been through it, and it makes me even more motivated to make sure I'm really listening even more deeply to patients, really respecting their decisions and what they want to do, making sure that, you know, you're on board with things, and if there's things you want tested or investigated, we will do that. You know, it's, I think, really unfortunate that things haven't changed since I've had to interact this much with conventional care. But again, very motivated. And just in case anyone's worried, I'm fine. It's called Meniere's. It's a rare disease. It just has these flares every so often. No, it's not life-threatening, thank goodness. Just maybe could cause long-term hearing loss if it doesn't get under control, but I'm confident that I'll be able to figure this out. So, and also the vertigo. It's not fun, but feeling pretty good and been well over a month without any issues. So I think we'll be able to figure that out. But thank you all for kind of, you know, over the last few months as I've tried to navigate this and take a little bit of time off to take care of myself and figure this out. I really appreciate all of your support. So yeah, so I just wanted to update everybody. I hope with these changes, again, doing things so I can take better care of myself and really get back to what I'm here to do, to provide you the best healthcare and really listen, a different kind of healthcare. So hopefully I'll get back to videos and more articles and just more education and all that in the next few weeks as we settle from the dust of moving this weekend. And I look forward to hopefully seeing you all one day post-pandemic where we can give a hug and and not wear masks and see each other's faces. So I hope everyone hangs in there and you're staying healthy and doing what you need to do for you and really listening to that inner wisdom and knowing that that's been there this whole time. Just maybe now is a better time to reflect on that. So have a great weekend, everybody, and I'm sure I will see you soon.